Chickenpox is a highly contagious viral infection. Chickenpox is a highly contagious viral infection. Chickenpox, also known as varicella, is a self-limited infection that most commonly affects children between 5 to 10 years of age. The disease has a worldwide distribution and is reported throughout the year in regions of temperate climate. The peak incidence is generally during the months of March through May. Lifelong immunity for chickenpox generally follows the disease. If the patient's immune system does not totally eliminate the presence of the virus, it may retreat to a dormant stage in the skin sensory nerve cell bodies where it is protected from the patient's immune system. The disease shingles, also known as zoster, represents release of these viruses down the length of the skin nerve fiber and produces a characteristic painful rash. Shingles is most commonly a disease of adults. 2/12. What is the cause of chickenpox? Share your story. The varicella zoster virus, VZV, causes chickenpox. The disease is highly contagious. Over 90% of non-immune individuals will develop chickenpox following exposure. VZV is communicable by both direct skin-to-skin contact and via respiratory droplets, for example, coughing, sneezing, from the infected individual. While the average incubation period from viral exposure to onset of symptoms is 12 to 14 days, symptoms may appear as early as 10 days or as late as 21 days after exposure to the virus. What are chickenpox risk factors? Anyone can develop chickenpox when exposed to someone with the disease. There are 3 categories of patients who are at risk for more serious problems should they develop chickenpox. Fetuses of non-immune pregnant women infected with VZV between weeks 8 and 20 of their pregnancy or during the final 2 weeks of the pregnancy. Adults immune-compromised individuals. What are symptoms and signs of chickenpox? Rash. Healthy children generally experience 1 to 2 days of fever, sore throat, and malaise approximately 2 weeks following exposure to VZV. Within 24 hours of these symptoms, a characteristic rash develops initially on the torso and then spreads over the next 7 to 10 days outward to the head, arms, and legs. Skin lesions progress through a predictable evolution from a red papule bug bite appearance to blister, vesicle to a pustule pus-filled blister, which then scabs over. The vesicle and pustular fluids are highly concentrated with infectious virus particles. New lesions characteristically come in recurring waves over the skin surface. The patient may thus have newly formed papules, middle-aged vesicles and pustules, and crusted lesions all at the same time. At the peak of the disease, a patient may have over 300 skin lesions at one time. Once all lesions are scabbed over and no new lesions are developing, the person is no longer contagious. The lesions rarely cause permanent scarring, unless secondary infection develops, see below. Lesions may commonly be found in the mouth and may also involve the genitalia. Complications. In healthy children, chickenpox is a mild disease. Adults are 25% more likely to have significant complications from the diseases. Common complications affecting both children and adults include the following. Skin infection. Secondary bacterial infections caused by either Staphylococcus or Streptococcus bacteria are well described. Rarely, an invasive form of Streptococcus can quickly spread throughout the body and may be life-threatening. Pneumonia. This is a relatively rare complication in healthy children but is the primary cause of hospitalization for adults, occurring in 1 in 400 cases, and has a mortality, death, rate of between 10% to 30%. Neurologic complications. Children most commonly develop an inflammation of the balance center of the brain called acute cerebellar ataxia. Symptoms of abnormal eye movements and poor balance develop in about 1 in 4,000 children approximately 1 week into the skin manifestations of chickenpox. Symptoms generally last for a few days, and a complete recovery is common. Adults more commonly develop a more generalized brain inflammation, encephalitis, whose symptoms may include delirium and seizures. Some studies report a 10% mortality rate and a 15% rate of developing long-term neurologic side effects in survivors. Reye's syndrome, this rare childhood complication of chickenpox and influenza, is most commonly associated with the administration of aspirin. A rapid progression of nausea, vomiting, headache, delirium, and combativeness that may progress to coma is a common pattern of deterioration. Supportive measures are the only therapy. Rare complications, hepatitis, kidney disease, ulcers of the intestinal tract, and inflammation of the testes or chitis have all been described. Chickenpox lesions involving the eye may cause scarring and permanently affect vision.